My name is Sarah Fitzloff. I'm a third-year medical student, and today I'm here to talk to you about the use of clinical autopsy in older adults. The objectives I'm going to cover today are listed here. I'll begin by talking about the decreasing autopsy rate, highlighting the disparity that affects our older adult population. Next, we'll go over some common reasons for this decreasing rate. And finally, I will suggest an approach that you can use to broach the subject of autopsy with your patient or their family. So why do we still need to do autopsies? Well, there are really three big areas that can be greatly improved by the clinical autopsy. First, education and research. This is how we advance the field of medicine. The pathologic examination is still the gold standard of diagnosis. Tissue can be used for medical research, and public health and epidemiologic research rely on having complete, accurate death certificates. The second area is quality improvement. There's never a case where an autopsy does not at least provide valuable feedback for the practitioners involved in the patient's care. And lastly, autopsy findings can have implications for living family members. Sometimes, important genetic or infectious information is revealed that could affect the health of others. And furthermore, increased knowledge about why a loved one died can help provide closure and be an important part of the grieving process. Still today, despite advances in technology, autopsies uncover new information in about 30% of cases. This rate has remained fairly consistent over time. And actually, a very recently published study looking at cases from 2015 through 2018 revealed a major discrepancy between clinical and postmortem diagnosis in 27% of cases. I got this quote from Sir William Osler's thesis, and I think it remains true today. To investigate the causes of death, to examine carefully the condition of organs after such changes have gone on in them as to render existence impossible, and to apply such knowledge to the prevention and treatment of disease is one of the highest objects of the physician. So what is the rate of clinical autopsy? Most physicians are aware that autopsy rates have been declining for the last few decades. Prior to 1970, autopsies were performed on about 40 to 60% of all deaths occurring within the hospital. Today, that rate has decreased to below 5%. This varies depending on location. Rates are higher in large academic institutions in comparison to a rural hospital, for example. This chart, published by the CDC, depicts autopsy rates in the U.S. from 1972 through 2007, and you can see that the rate declined by over 50% during that time. So why does all of this matter? As autopsy rates decrease across all age groups, it is concerning in the older adult population in particular. Autopsy rates are especially low in adults older than 65, as you can see in this graph of autopsy rates by age. As our population continues to shift to a greater proportion of older adults, our clinical autopsies remain concentrated in younger adults. As a matter of fact, we know that as the age at death increases, physicians are less likely to request autopsy, and family members are also less likely to grant permission. There's an assumption that in a lot of our older adults, we know what caused their death. However, there is a very interesting retrospective study that found that our agreement rate between clinical and postmortem diagnosis is actually lower in cases of adults over the age of 60 in comparison with younger groups. And certainly, there is enormous value in the information gained from autopsy of our older adults. This is the population with the most comorbidities to show us how diseases affect each other, the population that can teach us the most about disease processes over time, and the impact of the treatments that we have administered over the years. So what are some common reasons for why our autopsy rate is decreasing? This table is from a review and analysis of hospital and nursing home attitudes towards autopsy. Some of those reasons cited include the high rate of patients dying in nursing homes, which inherently have to overcome more barriers in order to obtain autopsy in comparison with deaths that occur within a hospital. One major barrier is cost if they are not associated with the hospital system. Other reasons include physician attitudes and fear of litigation, the presumed diagnostic accuracy and completeness from imaging and other diagnostic tests, as well as cultural, religious, and personal reasons. The biggest impact that we can have as physicians to increase our autopsy rates and accrue the knowledge available to us from our patients after death is to start asking. We need to know both when to ask and how to ask. When most people think about asking for an autopsy, they think about asking the next of kin after their loved one is deceased. However, I would propose, and others have proposed, that it may be better to ask the patient themselves prior to death as part of advanced care planning. One major advantage to this is it takes the guesswork out of what the patient would have wanted in this situation, and it also might lessen the stress of bereaved families following death. Advanced care planning is becoming more and more important as our population ages and our medical technologies advance. It's even available through online platforms nowadays. In fact, a recently published study evaluating digital advanced care planning included questions regarding autopsy. They found that 31% of people wanted an autopsy if their doctor thought it could help others, and another 28% wanted one if there were questions about their death. On top of that, the AAFP actually has an example advanced directive form on their website that includes options for autopsy if you wanted to see how to incorporate this into your conversation with your patient. Regardless if you are asking the patient directly as part of advanced care planning or if you're asking their next of kin after death, it's important to know how to ask. The palliative care department at Stanford offers some suggestions for inquiring about autopsy. First, you present autopsy as an option. Ask about their prior understanding about autopsy. What prior discussions or plans had they made? Indicate that autopsies can be limited in any way. You could decline examination of the brain, for example. You could even limit it to just biopsy of the diseased organ. Always reassure them that the person's remains are treated with respect and dignity throughout the entire process. Next, identify the potential benefits of autopsy. There are benefits specific to the family. It may provide closure for them to have a better understanding of why or how the patient died. It can clarify questions they still had, and it may even reveal genetic information that could be helpful for family members. There are benefits for the clinicians who took care of the patient. It gives them a better understanding of the illness and provides feedback that they can use to take better care of future patients. Additionally, it has extensive benefits for society by expanding medical knowledge as well as educating future physicians. You also want to anticipate possible concerns they may have, including personal, religious, or cultural objections. They may wonder about disfigurement of the body and should be reassured that they may still have an open casket funeral. All cuts are hidden and it would not affect the look of the body. They may have questions about the timeline and should be comforted that autopsy should not delay funeral or burial services. And certainly you should discuss costs with them. Most of the time, the cost of autopsy is covered by the hospital in which it is taking place. However, this is something you should know about your institution in order to accurately inform your patients. And finally, explain the plan for communicating the results. Remind them that you are available to answer any questions throughout the process, and they can also contact the pathologist directly if they wish. I hope today that you have learned about the importance of the clinical autopsy and the value that it has, especially in our older adults. And most of all, I hope you feel more confident talking to your patients or their loved ones about this subject. Thank you for listening.